Good morning, guys. Tony Maritato here. So I am out of the clinic today. Let's jump into the Facebook group, the Total Knee Replacement Support Group for Kind People. Let's see if I can find some answers to questions that you can ask. All right, let's see what we've got. So you guys can't see it, but behind me on the screen, Sandy's asking, when do they start using ice on you in the hospital? So, Sandy, I've had people that get ice packs put on them as they're in the recovery. I've had surgeons that will have their patients come with the ice machine so that they can put the, I don't know what they call it, but basically the pad that circulates the water, they can put it in under the dressing so that when they wrap it, that cooling pad is in there. Everybody's different. Talk to your surgical team, see what your surgeon's planning to do because everybody's going to have their own protocols. Art said, I keep seeing more posts about people needing revisions because their implants are loose. How common is this? Well, Art, I don't have the numbers, but I can tell you that in my experience, it's not that common. It's very rare, in fact. I can tell you 20% of people after a total knee replacement either have the same or worse pain. They're not happy with the outcome, but that's not necessarily associated with revisions. I am familiar with cases where the implant becomes loose, but it's a very rare situation. I could probably count on one hand how many times I've seen it in my clinic over the last 20 years. So it's not a common situation, but I think you hear about it more because it's kind of a shocking situation, and it's so unusual that when you do see it, it kind of leaves an imprint. Let's see. Nancy said, I had never heard of an MUA. For those of you who don't know what an MUA is, that's a manipulation under anesthesia. Until reading posts here about it, I'm almost 6 weeks post-op. I'm really struggling with range of motion. Now I'm worried I might end up needing an MUA. I'm going to tell you same thing I just mentioned to Art. It's not that common that patients undergo an MUA, but I will tell you that it's nothing like the original surgery. So I don't want you to be fearful of it. I don't want you to try to avoid it. We're going to try to get you the best recovery. Any therapist will. But if an MUA is what's recommended, then it's absolutely something that you should consider doing. There are cases in which an MUA is not going to be the best option. But let me read the rest of the comment. Who's had it done? What is it? How did it go? What was the recovery like? So I've got multiple videos on this channel showing real people who have undergone an MUA. In my area here, Middletown, Monroe, Ohio, we have surgeons that will do it typically on a Thursday, and the surgeon will send the patient directly to my physical therapy clinic like within an hour of undergoing the manipulation under anesthesia. And then I will provide therapy usually 10 to 15 days in a row through the weekend, every single day after the manipulation was done to try to maximize the benefit of the manipulation. I can tell you that I personally have never seen a negative outcome. I know that there are risks. I know that there could be complications, but personally, I've never seen a negative outcome. The worst case scenario I have seen is no range of motion improvement is realized. So you go through it and then you're back in the same boat. But it really depends on what is limiting the range of motion. Scar tissue is not the only thing that's going to limit range of motion. There are other factors involved, even stuff like pain sensitivity, fear, anxiety. There's lots of things that are going to limit a person's ability to move their knee. So the manipulation is a great option if your surgeon recommends it and you're comfortable with it. I've never seen a harmful or negative outcome come from it, but that doesn't mean that it doesn't have its own inherent risks. So go on the channel, look around. I've got multiple videos of real people that have been through it. So guys, I'm going to get off of here. I'm going to go take my dog Tucker for a walk. I'm going to try to jump on like this and do these Q&As a little more often. But absolutely, thanks so much for supporting the channel. I will catch you on the next video.